What started as a normal day for Solomon quickly took a turn for the worse in the heartbeat. Taking the stairs to his workstation, he experienced shortness in breath, only to later wake up on a hospital bed.
One of my colleagues actually who asked me if I could make it up the stairs, and I told her, it's going to be very simple, I can make it up the stairs. Unfortunately, those were the last words I said, and I collapsed from the stairs.
Joyous Solomon recounts his days in hospital with doctors running different body tests and scans.
In my life, I've never been hospitalized. I had never been hospitalized in my life. I'd never been getting problems with illnesses and the rest. The only thing I remember getting in the past was an accident. But the accident as well, I came out very alive and very okay.
After treating bacterial infections for some time, he was later told that he had a pulmonary clot in his lungs known as pulmonary embolism.
So I never had anything like a sign to know that I had a blood clot in myself. Even when I felt the pain, there is time in the hospital when I was still on medication and I used to cough and I would feel pain in my chest. I only felt it later on, like 2 days when I was hospitalized.
According to experts, pulmonary embolism is a blood clot that develops in blood vessels of the body, often stemming from the legs.
This clot usually doesn't form in the blood vessels of the lungs. It comes from elsewhere. So usually it comes from the deep veins of the lower limbs or the legs, and there it is called a DVT, a deep venous thrombosis.
Dr. Chimuli also notes that people can experience sudden shortness of breath, chest pain, and a feeling of anxiety if they have a blood clot.
So this shortness of breath could actually be associated with chest pain, and there are times that these two symptoms have actually manifested shortly after someone being involved or engaged in an exercise regime or routine or straining, and suddenly they feel this chest pain and they are short of breath and they actually stop the activity there and then. However, more to that, a patient could present with cough. Somebody coughs up, and many times when they cough up, they will cough up blood.
Solomon, who was hospitalized for over 3 weeks, is now on medication, fighting to regain stability of his life.
So right now when I am seated down and I notice it is 30 minutes that I've sat down, I stand up and I try to move around. That's the first thing, starting with my work. Then secondly, I try to take things a bit slower than I was doing them faster earlier.
Henry Mugenyi, NBS, Live at 9.